Okay, so for this video, I'm going to be applying a cold pack to my patient. So for the indications for doing this, he has edema, so we're going to try to reduce the edema. Our rationale is that the cold causes vasoconstriction, so narrowing the vessels so less fluid and less blood flow can get through and hopefully bring down some of that swelling and edema. Two precautions we want to look for is for patients who are very young or very old, and also patients with hypertension. Two contraindications that we don't want to do this with is if the patient has cold hypersensitivity or if they have a regenerating nerve. We do not want to put the cold over a regenerating nerve. So for this patient, he has edema. So what I'm going to do is I'm going to place these pillows under his leg just to elevate it a little bit so he has a little less blood flow strictly to that area. And I'm gonna do a dermatome test on him. So I have my two test tubes. This is my hot and this is my cold. So first thing, I'll hand sanitize, make sure before I touch him. Okay, and I'm gonna check his dermatomes to make sure his sensation is all intact. I'm gonna check his L2 to S1 because we wanna check everything that we're covering with the cold pack, everything one below or one above and one below. So I'm gonna test the sensation of his knee. So patient, if you could tell me if this is hot or cold.
Cold.
Okay.
Hot.
Good.
Cold.
Perfect. So I tested all of his dermatomes. Everything looks to be intact from that L2 to S1 region. So we can go ahead and proceed with our treatment. So I have my cold pack here. I'm gonna put one layer over it for sanitation purposes. Okay. And so I'm gonna put it over his knee and I'm gonna explain to him what he's gonna be feeling. So he's gonna go through 5 stages of cold. He's gonna feel an intense cold at first, then he's gonna feel burning, aching, and then he's gonna feel analgesia, which is the absence of his pain. And then the last stage, he's gonna go numb. So I checked his skin. All of his skin looks fine. I palpated the area. His muscle tone looks good. So I'm gonna start our treatment here for 10 minutes. I'm gonna give him his bell and his timer, put it next to him just in case he needs me for anything. But after 5 minutes goes by, I'm gonna check on the area, make sure there's no adverse effects such as extreme redness, weird discoloration of the skin, a rash or wheals. If that happens, I would stop my treatment, but it looks like he has none of that, so I'm gonna finish out our treatment till he reaches his numbness. So we're gonna do 10 minutes, and by then he should be numb, and then we can finish up our treatment and we reached our goal.